Good evening, everybody. I'm Sayukta from Prostate Wellness Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic: benign prostatic hyperplasia, BPH. BPH is the non cancerous enlargement of the prostate, usually begin in the 50s in men, and with it, many men may cause obstruction of urine flow. Many men have to get up and go to the toilet at night, and is the most troublesome aspect of this condition as it makes them tired during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can also be tiring for patients and can make traveling or attending events, etc., difficult. A doctor, such as a urologist, can treat this condition and help the patient to get relief. So, to throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us renowned urologist Dr. Karandeep Guleria, MS in General Surgery, MCH Urology. He has a rich experience of 4+ years and expertise in robotic and kidney transplant. He has worked at some elite hospitals and currently practicing at Max Hospital, Saket, as a consultant. A very warm welcome to you, Dr. Karandeep Guleria.
Thank you. Thank you.
It's such a pleasure to have you with us. And today we are going to talk on a very common condition that normally every aging male faces, right, with their prostate. That is, in normal terms, called enlargement of prostate. So,
Yes.
doctor, what is BPH?
So basically, every male has an organ which is known as the prostate gland, and usually it helps in reproductive functions, where it gives volume to the semen. And usually, this gland, by the age of 25, 30, it starts to grow because of many reasons. And when it grows to a point where it obstructs the urine flow, so what happens is that the urine tract, the pipe through which we pass our urine in males, will grow through the prostate. And as the prostate becomes bigger in size, it will then start to compress this pipe. And that will lead to problems in your urination. So this, when this occurs, we call it benign enlargement of prostate, because of which there are symptoms in your urination.
Right. And let's talk about the symptoms as well, doctor. Frequency is definitely one of them, but what
Yes.
are the other associated symptoms, doctor?
So collectively, we call these symptoms as lower urinary tract symptoms, and they comprise of a number of things which a patient will experience. Maybe not all, but he'll experience some of them at some point if he's got an enlarged prostate. Obviously, one of the most common being increased frequency, as you said, where the person will feel as if he has to go and pass urine almost every hour or every 2 hours. He has to wake up at night to pass urine multiple times. In technical terms, we call it nocturia. And the other symptom which a lot of patients come to us with is urgency. So urgency means when they have the urge to pass urine, they're not able to hold it. So it becomes very socially embarrassing for them. So if they're out and about in some social gathering, or they're at a function or a meeting, then the urgency part becomes a little embarrassing for the patient. So the other symptoms that the patient can have because of the direct enlargement of the prostate is that it can obstruct the flow of urine. So they'll start to notice that the flow of the urine that they had previously, it's not as good now. And so they'll complain of intermittency in the flow of urine, or that they have to wait and then after some time the flow starts, or that sometimes what happens is that they really have to push or bear down to empty their bladder. And in general, these patients who have a obstructed urine flow also complain that sometimes once they've gone to the toilet to pass urine, they'll feel that they've not been able to completely empty their bladder, and that they have to wait some time more and then empty it again, and then they feel that they have completely emptied the bladder. So these are the main symptoms that these people come with. And as in, when the symptoms progress, they become more complicated, and these people can also present with infections, multiple infections which reoccur. And sometimes these infections can go up also, and they can cause kidney infections, which can even lead to sometimes kidney failure in these patients.
Okay, we'll talk about that as well. But before that, doctor, as you said, that BPH or enlarged prostate is associated with age. Now, with aging, so many things are associated. We get wrinkles, we get, gray hairs, etc. Now, is it that normal? And if so, then why? Because it's just the symptoms that we should be worried about, or else also it can be really dangerous.
So, prostate, unfortunately, is one of those glands which will not stop growing as we grow. Usually, what happens is that in our body, most of the organs or glands, they have a limit. So, we will grow to a certain point till a certain age, and then we hit a plateau. But it's not the case with prostate. We don't exactly know what is the reason, but we know it's got to do something with hormones, where we say that because testosterone keeps on increasing in the males, so the prostate kind of feeds on that testosterone and keeps on growing. So what happens is that the prostate will keep on growing throughout the our entire age. And what happens is the prostate has a capsule around it, which kind of obstructs the growth towards the outside. So when the prostate starts to grow, it kind of grows towards the inside. That is where the urinary pipe is, which causes all the symptoms. And it has been seen in a lot of studies that after the age of 70, almost 70% males will have an enlarged prostate. And after the age of 80, almost 90% of all males will have an enlarged prostate. So it's not that uncommon. And a lot of people by the age of around 45, 50 start to experience these symptoms. And what is important is that it is not just that an enlarged prostate could be benign. The other thing that you have to keep in mind is that sometimes it can also be a malignant or a cancerous lesion, which will also cause the same symptoms, because that will also lead to an enlarged prostate. So the first thing is that when you have these symptoms, you have to get yourself checked, and first we have to confirm whether it's in benign enlargement or not, and then we go about the treatment, whether it is benign or malignant. So yes, definitely you have to rule out everything else before you can just proceed with the treatment of benign enlargement.
Right. So the thing is that whatever symptoms you just mentioned, doctor, these are so common, especially after certain age, and people do associate it with aging. They'll say, "I see, I'm diabetic, so I'm bound to have these symptoms," or I'm aging, so definitely, frequency, urgency. That's what they normally, put forward. They'll never go at the first place and contact or take advice from a doctor. They'll it will keep hampering their quality of life. As you said, they'll feel very tired because of course their night sleep is disturbed, etc. Now, how to convince them, because our viewers are here who are watching, how to convince them that how important it is to a examine yourself after a certain age, so that in case there is any abnormality, it will come to notice. And b, it's just not about the symptoms, it's just not about the benign thing, it can be cancerous as well. So how to make them aware about it?
So what we suggest is that if you have any symptoms which I had just mentioned, like frequency, urgency, you have to wake up at night, it's always better to go see a urologist then itself, because at that time we can do certain tests, we can rule out certain things, and we can go about the treatment in a more stepwise or a more structured approach. And what happens is that if it is a benign enlargement of the prostate, if we catch it earlier, then with medications, around 80 to 90% of the patients will have a relief in their symptoms. But if you let the program progress, or if you let the prostate become bigger and bigger, then there is a very high chance that medications might not be effective, and that you might need to have a surgery in the end. And that is why it is always better to come a little early if you have symptoms, especially the symptoms that I've just told you. But sometimes what happens is that there is, like you said, there are certain diseases which will also have similar symptoms, like diabetes. So in that case, we have to ascertain whether it is just diabetes which is causing those symptoms, diabetes or old age, or whether it is the prostate, or whether it is a combination of both. Because in that case, the medications that we give will become different. Also, by getting yourself checked earlier, you will be able to rule out prostate cancer at an early age. The current recommendations for guidelines, we don't have as such any recommendations in the Indian population as such, but the Western recommendations do say that we should get a yearly prostate exam and a prostate specific antigen, which is the basic blood test for prostate cancer. We should get that done yearly. So what happens with that is, if we can catch prostate cancer at a earlier stage, we can cure it completely, because prostate cancer is a very good cancer because it stays localized for a very long time. So if you
Right.
can catch it at that time, you can completely cure the patient. And that is why it is always better to come earlier with these symptoms, especially to a urologist.
Right. So the bottom line is that as soon as you see these symptoms, please don't judge by yourself that it's because of your aging or because you are diabetic or because you have OAB, etc. Just go and consult the right person, which is a qualified urologist, and also it will rule out other things as well. Now the thing is, doctor, is it always does it always have symptoms or could it be asymptomatic as well?
So benign enlargement of prostate is the term technically is used when you have symptoms. So there can be an enlargement of prostate when there are no symptoms. In that case, we usually don't do anything. We follow up the patient. We have some objective tests where we check the flow of urine for that patient. And if we find there is some obstruction or the patient is not able to pass urine properly, then we do start medications. But usually, if there are no symptoms, we do not, try to treat it too much, because then it kind of heads towards over treatment. But yes, if there are symptoms, then something has to be done. So with the enlargement of the prostate with symptoms, that is termed as benign enlargement of prostate. But if you don't have any symptoms, you can still have an enlarged prostate. You should get your flow test done, which is known as a uroflowmetry test. If the flow is absolutely normal with an enlarged prostate, then nothing to be done. You just have to be kept under observation and follow up. If the flow test turns out to be obstructed, that means that your flow is being obstructed because of your because of enlarged prostate, then yes, we do start medical management for that.
Okay. Now we would like to talk about the treatment options available. You said you have medicines and you also have surgeries, etc. We would like to know all about it, doctor.
So uh, the treatment for prostate over the years has become very advanced. Initially, 20-25 years ago, there were no medications as such. Everybody had to undergo a surgery if they had a prostate, enlarged prostate. Now, in the last 20-25 years, we have been able to develop drugs which control the size of the prostate, one, and they kind of also help with the flow of the urine. So, the most common drugs that we have are alpha blockers, which are tamsulosin, silodosin. So what these do is they kind of control the size of the prostate, and they help with the flow of the urine. They relax the urethra, and then they let the urine flow out properly. Also, we have certain drugs which are able to shrink the prostate. Those are known as 5-alpha reductase inhibitors. They usually finasteride or dutasteride that we have. And we also have drugs which are able to relax the bladder. So you see, what happens is that once you had an enlarged prostate for a long time, so the bladder keeps on pushing against a, a prostate which is enlarged. So at some point, the bladder is going to become overactive, because it's like it's pushing out urine against a brick wall. So it has to apply more force. So the bladder becomes a little overactive. So we have drugs for that also. So these kind of help in reducing the frequency as such of urination. Then most of these drugs, if we are started early in the patient, around 80 to 90% of the patients will have a fairly good symptomatic relief with the drugs. But there are still 10-15% patients who require surgery for prostate. And when we go about for surgery, first we have to ascertain whether it is a benign or a cancerous lesion. For that, we have PSA, MRI, and all that. After we have ascertained it is a benign prostate, then there are multiple surgeries that we have, and all of them we do now endoscopically, usually for a fairly mid-size or even a large size prostate. where there are no cuts on the patient, we go via the urinary tract itself and we resect out the prostate.
Right. And as you said, prostate is definitely associated with age. So definitely people over 45 or 50 or 60, 70, 80 will get it. And definitely a very general concept or notion that we have in our head is that surgery means, we'll have to be on bed or there will be, insertion. But as you said, the technique has actually advanced. Now, is it safe for even elderly people who are in their 70s or 80s to undergo these surgeries, or there you just stick to medication?
So initially we start with medication, but if there is no improvement with medication, then obviously we head towards surgery. If there is any gross problem with the surgery, we kind of correct that first. But in general, all of these surgeries are very safe surgeries. They're not very big surgeries. Uh, they hardly take 1.5 to 2 hours, and the patient's usually back home by the second day. So these are not very big surgeries, and all of them are done endoscopically. So there's no cut which is given, and there is just a catheter which is kept for 3 to 5 days. And after that is removed, the patient can go about his normal life. Uh, there are sometimes we have to do open surgeries when the prostate is very large, but now more or less that has also been kind of overtaken by the robot. And so we do a lot of robotic prostates here as well in Max, where we give small keyhole incisions, and via that we do the prostate, we remove the prostate for very large prostates. Smaller mid-sized prostates, they can be done endoscopically easily.
Right. And doctor, because we are talking about, prostate enlargement, and you also mentioned that it could be cancerous as well, not the benign one. Of course, it's benign because it's non-cancerous, but enlargement could be cancerous. And for that, you do various tests as well. I'm sure you also mentioned about PSA. So what's PSA or the other tests that you normally, advise, and which can also tell us whether it's malignant or not?
Yes, so the basic test is PSA. PSA uh, is a time-tested old test that we have. So PSA stands for prostate-specific antigen. So this is a blood marker which is exclusively produced by the prostate itself. So when the PSA is high, that kind of means that something's wrong with the prostate. And in general, PSA increases because of 2, 3 reasons only. One is obviously cancer. Second is when there is an acute infection in the prostate, sometimes the PSA can increase. And number three is when the prostate is grossly enlarged, when it is 7, 8, 9 times the normal size, then also PSA can increase a little bit. But the main thing that we have to rule out with an increased PSA is obviously prostate cancer, because that it is a very direct marker for a patient who has prostate cancer. And then we have supplementary tests with which have now come with PSA. There are certain urinary biomarkers that we have, but those are not as dependable as PSA. And the other thing that we have is now a special MP-MRI for the prostate, which is a MRI which is done specifically for the prostate, which helps us to see if there are any cancerous lesions in the prostate. But obviously, these are all indirect tests which kind of point towards the diagnosis of cancer. But to prove prostate malignancy, we then ultimately have to do a biopsy of the prostate.
Right. Now, doctor, there's this famous, proverb that prevention is always better than cure. I'm sure with aging, there are certain things which can't be prevented, but then it can be, delayed. That if a person is getting is due to get, enlarged prostate at 50, at least we can delay it till 60, or maybe the process is not that high. Is there a way to do that?
Yes, you're absolutely right. So there have been studies which have seen that we can delay the symptoms that occur because of prostate enlargement, and that we can even delay the long-term effects of an enlarged prostate. And these studies have shown that people who have maintained a healthy lifestyle try to keep their weight in check, because it's seen that people who have a lot of extra fat, adipose tissue, they kind of have higher levels of testosterone in their body. So which kind of increase leads to a rapidly increasing prostate size. Also, people who have regular antioxidants, people who drink lots of water, and people who avoid smoking. These in these people, it's been seen that the the symptoms of prostate usually occur at a later age as compared to people who are more say, let's say, obese, or have smoking history, or uh, who follow a diet which is not appropriate.
Right. So leading a healthy lifestyle can actually go a long way in
Yes.
or prolonging the effects of enlarged prostate. We have few viewers with us. There's Adi Jan. His question is, what is the success rate of various BPH treatments, doctor?
So with medication, I said it's around 70 to 80%, but it's seen that after around um, 5 6 years, sometimes it goes down to around 60 70%. So by 5 years, we say around 30 to 35 patients who are on medications might require surgery. And when it comes to surgery, the success rate kind of depends upon the size of the gland. So usually, normally a prostate is around 20 to 30 grams. If it's a mid-sized prostate, say around 30 to 60, then usually the success rate is quite high. It's more than 90%. And with larger glands, obviously success rate becomes a little lesser. But now, because we have lasers available to remove the prostate, and now we have robotic surgery as well. So even with larger prostates, we have seen patients, who are absolutely free of symptoms second day post surgery, and the success rate in these cases have now even reached around 95%.
Okay, and that's why it's important to go to the doctor at the right time.
Yes.
As soon as you go, shorter would be the treatment. You'll get relief very soon. So that's important. So please don't ignore, or don't just keep on suffering in silence. Go and contact a qualified urologist. We have Jayant Deshmukh with us. His question is: are there any long-term complications associated with untreated BPH?
Yes, exactly. So if you don't treat enlarged prostate timely, what happens is that it'll keep on growing, it'll keep on obstructing the flow of urine. Ultimately, this will lead to accumulation of urine in the bladder. So if you have fluid, or if you have water accumulating anywhere, the chances of it getting infected are very high. As you know, even in our household, if you have water kept somewhere in a pot or a pan over a couple of days, it'll get bad. So similarly, if urine is not being able to empty out from the bladder because of the prostate, it'll get bad. So you have infections, you have repeated infections, which is the most common long-term effect of enlarged prostate. Sometimes what happens is that if you don't treat a prostate properly and it keeps on enlarging, the blood vessels over the prostate can rupture, and this can lead to bleeding in the urine, which is known as hematuria. Then other thing is that sometimes because of this, the pressure in the urinary tract increases. So when the pressure increases, this pressure is then transmitted backwards into the kidneys. So this can lead to kidney failure as well in certain patients, or kidney injury.
Right. So it can go really bad. So it's better to
Yes.
go and take advice from a doctor. Deepak Saxena is here. His question is: can BPH increase the risk of developing prostate cancer?
So BPH per se does not increase the risk of developing prostate cancer, but that does not mean that a person with BPH cannot have prostate cancer. So any person with BPH will have the same risk of developing prostate cancer as anybody in the general population has. But BPH does not mean prostate cancer.
Right. Vyapi is here. Question is: how often should I have follow-up appointments or checkups?
Every year, if you're doing fine, no symptoms, and you're fine with medications, it is recommended that you follow up with your urologist every year, at least
Right.
once a year.
Right. And once a person is treated, right, or for BPH, are there chances that because it's a process of enlargement, right, doctor? So, is there a chance that it will increase again and again? We'll have to
Yes.
do surgery,
So what
etc.
happens is that so when you give medications obviously there's a chance because you've not done anything to prostate. You just give medications to relieve the patient of the symptoms. So there is always a higher chance of the patient having recurrence or a larger prostate later on in follow-up.
Right.
But after surgery, what happens is that we don't remove we, the entire prostate usually. What happens is that we remove the core or the majority of the central part of the prostate so as there is no obstruction in flow of urine. But what happens is that so after this, these patients are fine for the next 15, 20 years. But 15, 20 years is a long time. In that time, again, the prostate can grow, encroach on that area and lead to symptoms again. So usually we see that patients who've undergone these surgeries after 20, 25 years, they then again kind of develop symptoms. But it takes that much time. It takes around 15, 20 years for them to develop symptoms again. It usually does not come before that.
Okay. And one more question from a viewer, Abhishek is here. His question is, are there any dietary or nutritional recommendations for managing BPH?
So the recommendation is that you have a low fat diet with antioxidants, which are high in antioxidants, and that you drink a lot of water, and you do regular exercise, where you try to keep your body fat content as low as possible, because it is the extra body fat which kind of causes the increased testosterone in these patients, which is seen to cause an enlarged prostate.
Okay, doctor. Doctor, before we sum up the whole session, any take-home message for our viewers?
Yes, just that prostate is a problem. It is a very common problem. It will happen to almost every male out there, and you should not be afraid if you're having any of these symptoms. You should promptly meet your doctor, see them, because the treatment options for prostate are multiple, and they all have good outcomes, and you can be symptom free and live your life to your fullest if you come to us timely, that is.
Thank you so very much, Dr. Karandeep Guleria, for your valuable time. And it has been quite an informative session for our viewers. And we really look forward for many more such sessions with you in coming times. Thank you.
Thank you.
And viewers, thank you for your active participation. For more information and updates, stay connected on our FB page, Prostate Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day ahead.